Welcome to our channel. Today, we're diving into some of the worst blood pressure advice you might receive from your doctor. Now, I'm not saying your doctor is out to get you, far from it. But sometimes misunderstandings happen, or maybe they're relying on outdated information. That's why it's so important to be informed and advocate for your own health. Remember, while it's rare for doctors to give truly harmful advice, misunderstandings or outdated information can sometimes lead to less than optimal recommendations. That's why we're here to arm you with the knowledge you need to have productive conversations with your doctor and make the best decisions for your health. Throughout this video, we'll be debunking some common misconceptions and highlighting why certain pieces of advice might not be the best for everyone. Always consult with your healthcare provider for personalized advice. Okay, let's talk about this first piece of advice. Just monitor your blood pressure at home and don't worry about it unless it's really high. Now, on the surface, this might seem reasonable. After all, home blood pressure monitors are great tools for taking control of your health. They are convenient, easy to use, and can provide you with valuable information about your cardiovascular health. But here's the catch. High blood pressure is often called the silent killer for a reason. It can quietly cause damage to your body for years before symptoms become obvious. You see, many people with high blood pressure don't experience any noticeable symptoms, especially in the early stages. This lack of symptoms can lead to a false sense of security. That means you could be walking around with elevated blood pressure and have absolutely no idea. And that's the danger. You might feel perfectly fine, but your body could be under silent stress. Think of it like this. Imagine a small leak in a pipe. You might not notice it at first, but over time that slow drip can cause significant damage. The same goes for high blood pressure. It can slowly but surely damage your arteries, heart, and other organs. Similarly, even slightly elevated blood pressure, if left unchecked, can put extra strain on your heart and blood vessels, increasing your risk of serious health problems down the road. This includes heart attacks, strokes, and kidney disease. So, what's the takeaway here? It's important to be vigilant about your blood pressure even if you feel fine. While occasional home monitoring is better than nothing, it shouldn't be your only line of defense. Home monitoring can help you keep track of your blood pressure trends, but it doesn't replace professional medical advice. Regular checkups with your doctor are crucial for catching high blood pressure early on, even if you feel perfectly fine. Your doctor can provide a more comprehensive assessment of your cardiovascular health. Think of your doctor like your health detective. They have the tools and expertise to detect subtle clues that you might miss on your own. They can identify patterns and risk factors that you may not be aware of. They can analyze your blood pressure readings over time, assess your individual risk factors, and recommend the most appropriate course of action. This might include lifestyle changes, medication, or further testing. Remember, early detection is key when it comes to managing high blood pressure effectively. The earlier you catch it, the easier it is to manage and treat. Don't wait for symptoms to appear before taking action. By then, it might be too late to prevent serious complications. Be proactive about your health and make those regular doctor visits a priority. Your future self will thank you for taking these steps to protect your health today. Let's tackle another common misconception. You're too young to have high blood pressure. Now, while it's true that high blood pressure is more common as we age, it's absolutely crucial to remember that it can affect anyone, regardless of age. In fact, I've seen perfectly healthy young patients in their 20s and 30s with high blood pressure. It's a myth to think you're immune just because you're young. Several factors can contribute to high blood pressure in younger individuals, including genetics, lifestyle choices, and underlying health conditions. For example, a family history of high blood pressure can significantly increase your risk even at a younger age. Similarly, lifestyle factors like a diet high in sodium, lack of physical activity, excessive alcohol consumption, and chronic stress can all contribute to elevated blood pressure. Now, here's the thing. Dismissing high blood pressure in younger individuals can have serious consequences. Untreated high blood pressure can silently damage your arteries and increase your risk of heart disease, stroke, and other health problems later in life. That's why it's so important to take any signs of high blood pressure seriously, no matter your age. If you experience symptoms like frequent headaches, nosebleeds, or shortness of breath, don't brush them off. Talk to your doctor and get your blood pressure checked. Remember, early detection and management are key to preventing long-term complications. Don't let the myth of being too young prevent you from taking control of your health. Chapter 3, just cut back on salt and exercise more. Now let's talk about this advice. Just cut back on salt and exercise more. On the surface, this sounds like solid advice, right? It's simple, straightforward, and easy to remember. And don't get me wrong, a healthy lifestyle is incredibly important for managing blood pressure. Regular exercise and a balanced diet can do wonders for your overall health, but here's the thing, it's not always enough. Sometimes, despite our best efforts, we need a little extra help. While lifestyle modifications like reducing sodium intake and increasing physical activity are crucial first steps, they might not be sufficient for everyone. For some, these changes can feel overwhelming and frustrating, especially when results aren't immediate. Some individuals may require medication to manage their blood pressure effectively, even if they live a healthy lifestyle. Medication can provide that additional support needed to keep blood pressure in check, even if they live a healthy lifestyle. It's not a sign of failure. It's about finding what works best for you. Think of it like this. Imagine two people trying to lose weight. One person might be able to shed those extra pounds through diet and exercise alone, while the other might need additional support like medication or surgery. Both approaches are valid and can lead to successful outcomes. While the other might need additional support like medication or surgery, both approaches are valid and can lead to successful outcomes. Similarly, the underlying causes of high blood pressure can vary from person to person. Genetics, lifestyle, and other health conditions all play a role. Some individuals may have a genetic predisposition that makes it more challenging to control blood pressure through lifestyle changes alone. This genetic factor can be a significant hurdle. Others might have underlying health conditions that contribute to elevated blood pressure, requiring a more tailored approach. Conditions like diabetes or kidney disease can complicate blood pressure management, requiring a more tailored approach. It's essential to consider all these factors when developing a treatment plan. The key takeaway here is that managing high blood pressure is not a one-size-fits-all approach. What works for one person might not work for another. While lifestyle modifications are essential, they are just one piece of the puzzle. It's crucial to work closely with your doctor to determine the most effective treatment plan for your individual needs. Your doctor can help you navigate the complexities of blood pressure management. They can assess your specific situation, consider your medical history, and recommend the best course of action. This might include lifestyle changes, medication, or a combination of both, and recommend the best course of action, which may or may not include medication. Remember, the goal is to find the most effective way to manage your blood pressure and maintain your health, which may or may not include medication. The journey to managing blood pressure is unique for everyone, and finding the right balance is key. Chapter 4. You don't need to see a specialist. Let's address this final piece of advice. You don't need to see a specialist. This is a common misconception that can often lead to unnecessary stress and confusion. Now, in many cases, your primary care physician is fully equipped to manage high blood pressure. They have the training and experience to handle a wide range of health issues, including hypertension. However, there are certain situations where seeing a specialist, like a cardiologist, might be beneficial. Specialists have access to advanced diagnostic tools and treatments that can be crucial in complex cases. Think of it like this. Your primary care physician is like a general practitioner. They have a broad understanding of many different health conditions. They are your first line of defense in maintaining your overall health. A cardiologist, on the other hand, is like a heart specialist. They have advanced training and expertise in diagnosing and treating heart-related issues, including high blood pressure. Their specialized knowledge can be invaluable in certain scenarios. So, when might it be a good idea to see a cardiologist for your high blood pressure? It's important to recognize the signs that indicate a need for specialized care. Well, if your blood pressure is consistently very high despite lifestyle changes and medication, a cardiologist can help determine the underlying cause and recommend more targeted treatment options. They can offer insights that might not be apparent in a general practice setting. Similarly, if you have other health conditions that complicate your high blood pressure, such as diabetes, kidney disease, or sleep apnea, a cardiologist can provide specialized care and coordinate your treatment plan. These conditions can interact in complex ways that require a specialist's expertise. A cardiologist can also help in coordinating care among different specialists, ensuring that all aspects of your health are being addressed in a cohesive manner. This can be particularly important in managing multiple chronic conditions. Remember, seeking a second opinion or consulting with a specialist doesn't mean you're doubting your primary care physician's expertise. It's about being thorough and ensuring that you're exploring all possible avenues for your health. It simply means you're taking an active role in your health and exploring all available options to ensure you're receiving the most appropriate care. Being proactive can make a significant difference in your health outcomes. Don't hesitate to advocate for your health and seek specialized care if you feel it's necessary. Your health is your most valuable asset, and taking steps to protect it is always worthwhile. Your health is worth it. Always remember that you have the right to seek the best possible care for yourself. So there you have it, some of the worst blood pressure advice you might receive and why it's essential to be informed. Remember, knowledge is power when it comes to your health. Remember, if you have concerns about your doctor's advice, don't hesitate to ask for clarification or seek a second opinion. Your health is important, and it's essential to have a clear understanding of your treatment plan. Thanks for watching, and don't forget to like, comment, and subscribe for more health tips.